Good morning, everyone. So before we begin the technical part of our session, I would like to start with a short story. It is hypothetical, but it reflects real situations. Imagine a woman called Aisha. Aisha is a citizen. She falls in love with someone from another country, they follow the legal procedures, they receive official approval, and they build a family together. They have children. The children grow up here. They go to school here. Their friends are here. Their memories are here. But there is always one quiet question in the background. What is their legal status? Will the father be allowed to remain with the family? Will the children have access to education and healthcare like other children? Will they feel secure? Now imagine the relief when a government decision allows the foreign husband to remain with his family until the children reach adulthood. Imagine the difference it makes when the children are granted educational and health facilities. Suddenly, stability replaces uncertainty. Security replaces fear. Now imagine another family. A child is born with a disability. The parents are worried. They are not sure where to go. They are not sure what services exist. They are not sure what rights their child has. But then there are trained specialists in health centers. There are inclusion programs in schools. There are awareness campaigns explaining entitlements. Step by step, the child is not isolated, but supported. And imagine a community where harmful practices against children are no longer hidden or ignored, because health educators and community groups are trained to raise awareness. Because campaigns explain the legal and health consequences. Because people begin to understand. So these are not just policies. These are real lives. Now let us move gently from the story to the bigger picture. When we talk about human rights in this context, we are talking about practical measures that affect families directly. For example, allowing a foreign husband married to a citizen woman to remain with his family until the children reach adulthood is not just an administrative decision. It supports family unity and protects the best interests of the child. Providing educational and healthcare facilities to children of citizen women married to non-nationals ensures that these children are not excluded. It helps them live with dignity and access essential services. At the same time, the Human Rights Commission recommends studying the broader situation of children born to citizen women married to foreigners, especially after official marriage authorization. Why is that important? Because policies need to be based on careful study. We need to understand the legal and social effects before taking long-term decisions. That way, solutions remain in line with national laws and also consistent with international commitments. There is also a recommendation to consider granting permanent residency to these children without violating national legislation. This shows a balance. It respects national sovereignty and at the same time, it seeks to enhance stability for families. Now let us talk about child protection. The Ministry of Health has prohibited harmful practices against children and has implemented training programs for health educators and community support groups. These groups act as a bridge between institutions and society. They reach families. They speak to communities. They help prevent harm before it happens. The Commission also recommends intensifying awareness campaigns, especially in cooperation with civil society organizations. This is important because legal awareness matters. When people understand the legal and health consequences of harmful practices, including practices such as female genital mutilation, they are more likely to reconsider them. Awareness changes behavior over time. Let us also focus on children with disabilities. There is a clear recommendation to expand inclusion programs so that more schools in each governorate can accommodate students with disabilities. This is necessary because the number of registered students increases every year. Inclusion ensures that children with disabilities can learn on equal footing with others. There is also a recommendation to strengthen diagnostic services in main health centers. Early and accurate diagnosis allows early intervention. Early intervention improves long-term outcomes and reduces pressure on hospitals. In addition, building the capacity of professionals who work in diagnosis, treatment, rehabilitation, and care is essential. Rights are meaningful only when services are effective. Trained professionals make those rights real. Finally, awareness campaigns must also target persons with disabilities and their families, so they understand the services and entitlements available to them. When families know their rights, they are empowered to claim them. So when we look at all of this together, we see something very important. Human rights are not abstract principles written on paper. They are decisions that allow families to stay together. They are policies that protect children from harm. They are programs that support inclusion. They are awareness efforts that prevent suffering. They are services that help the most vulnerable live with dignity. And maybe the key idea here is this: behind every recommendation, there is a human story. Behind every policy, there is a child, a parent, a family. And that is why this discussion matters.